Dr. Campbell has published over 90 studies in peer-reviewed medical journals and chapters in medical textbooks. He currently is the editor-in-chief of 2 peer-reviewed medical journals and the author of the best-selling book, The Key to Longevity, An Expert's Comprehensive Guide to Fighting Inflammation. He is one of the world's most trusted experts in his field, specializing in natural treatment, and he serves as medical advisor to several companies. He has received awards from several national and international organizations, and he lectures regularly at Oxford University and various global medical conferences. Please join me in welcoming Dr. Andrew Campbell.
I do not have any financial interest of a product in my talk or with any companies offering grant monies for this continuing dental and medical education program. I get nervous standing in front of a bunch of people staring at me who I don't know. Comes from a bad experience I had in the first few days of medical school. The first day was orientation, and we sat in this huge flat room. And back then we didn't have nice screens like this. We just had one screen and 35 millimeter slides and an overhead. So we were supposed to sit in alphabetical order, and my name being Campbell, I was all the way against the wall in the second row. I could see nothing. So I had to get notes from everybody else. And it was not an enjoyable experience. So I said to myself, to be a really good doctor, I'm going to sit in the front row in the center every time from now on. And so the next morning, which first day of class, I got there a little early, sat in the front row in the middle. Eventually the class filled and the professor walks in, and everybody gets quiet, and he looks around and he points his finger at me. He says, "Stand up, please." I stood up. He says, "What's your name?" "Campbell." He says, "Campbell, tell the class what are the causes of Hashimoto's thyroiditis." I said, "I don't know." I was going to say something smart like you got off the elevator on the wrong floor or something. So he says, "Okay, sit down." He says, "Class, this is your first day and your first lesson in medical school. Never say you don't know, because then people will think you're stupid. What you've got to say is, 'I've forgotten,' because then people will think you had more important things to think about." Yes, that's what my classmates did. They chuckled. Then a few weeks go by, and he looks at me again one morning, and he says, "Campbell, right?" He said, "Yes, sir." He says, "Stand up and tell the class what are the causes of ulcerative colitis." "I've forgotten." He says, "Sit down." "Class, this is a great tragedy for humankind. No one in the world knows what causes ulcerative colitis except for one person, and he's forgotten." I feel like Madonna with this thing. I'm not going to sing like a virgin or anything like that. So I'm going to take you through a trip, and we're going to start at the beginning of things. Where's the beginning? Mama. Any mothers in here? Okay. Good. Inside the womb, it's a sterile environment. Okay? Things are emerging now, but let's keep it sterile for the moment. Nutrients, oxygen, chemicals, medications, over-the-counter drugs. Mom went to eat Mexican, and she's got a little acidity, so she takes a Tums, and it's got artificial sweetener and artificial flavoring and artificial coloring. All that goes to the baby, the fetus as well. And then she's behind a big truck that's spewing forth particles, diesel particles, that too. Anyway, At the end, the baby returns carbon dioxide and waste matter to mom. She gets rid of that. What happens, and this happens to women at the strangest time, water breaks in the store, at the movies, odd places. And lactobacilli completely bathe and colonize the birth canal, vaginal area, vulva, upper thighs, etc. And that helps prevent candida and other organisms from growing, and it's an acidic because it's an acidic environment. Most importantly, the first things that enter a baby's mouth are mother's microbes. Okay, very important. And just as a fact, because in my training I delivered a couple hundred babies, all babies are covered with vernix, which is a kind of a waxy white coating. But nowadays what we do, or what OB-GYNs do and nurses in hospitals, they wipe that off quickly so that the pictures can be taken with mom and they're not covered. But it's actually a protective coating. So first few hours and days, mother's first milk contains lactobacilli. This is, believe it or not, a bacteria in mother's milk. It's called colostrum. It also transfers to the child very important protective antibodies. And this lactobacilli helps break down lactose, the major sugar in milk. A few days later, about 3 or so, the milk changes, mother's milk changes to regular mother's milk and more carbohydrates. Now, interestingly, one of these carbohydrates is oligosaccharide, which baby cannot digest. It's there to help the microbiome that's developing inside the baby. Okay, so then, we are born, everybody knows this, we're born with an innate immune system. We develop the adaptive immune system. And during the first 3 years, we develop immunologically, we develop neurologically, our brain and central nervous and peripheral nervous system, and metabolically. And by age 3, every child has developed the foundation for childhood, adolescence, adulthood, and old age of the microbiome. Now, what happens if people have a C-section? In the United States, it's pretty high. It's about 20%. Europe, it's about 4%. Well, why? I can tell you, my daughter was going to have my granddaughter around the 22nd of December. She was afraid her OBGYN would leave Austin, Texas, and come and ski in Stowe, Vermont. So she decided to schedule a C-section. I think it's because hospitals make more money. So do doctors, but not that much. But hospitals make a killing on C-sections. Oh, anyway, so let's take it to the next part. What happens? What is the consequences for the baby? It's lack of colonization, obviously, by lactobacilli. The first bacteria in that baby's mouth are from skin, from the personnel, or from instruments, etc. So in those children, asthma up to 80% more often than in babies with normal deliveries. Also, it's double the risk of allergy for cow's milk later on in life, and increased risk for food reactivities and for diarrhea. Just to give you an idea of how important that those lactobacilli, that first moment of life, are. Okay, so let's mention, now that we're talking about life, the genome, just to give you an idea. We're 23,000 genes. The microbiome is 8 million genes. Rice is somewhere around 120,000 genes. Wheat, 180,000. We just are 23. So our microbiome, our body, from head to toe, we're 37 trillion cells, 37 followed by 12 zeros. The total number of cells that make up the microbiome is 130 trillion. And the oral microbiome is approximately 1 trillion. So, the total surface of the gut, 200 square meters, approximately the size of a tennis court. That's what you're carrying inside you. If you stretch it out, flatten it, etc. There are more neurons, nerve cells, in the gut than in the spinal cord. So it plays a very important role. 1 ton of food is going to pass through the oral cavity every year in the average person. That's a lot of food. That's not only food, of course, it's also liquids. And so what happens? The oral microbiome is constantly bombarded with this stuff. You know, we're always, it's getting it all throughout life. Every time we eat, we sit, we're drinking, we're having something, etc. And we also have 9,000 taste buds we've got to satisfy. And just talking a little bit about the biofilm, because I think it's important. It's not part of this lecture because then I would make it a 2-hour lecture. But there's this balance, this equilibrium between the microbes that live in the mouth and the rest of them and the innate immune system. It's kind of like they're watching each other, you know, like 2 neighbors, kind of suspicious. Because if one goes out of whack, the other one comes and attacks it. So there's this watchful condition. And the resident microbes of the oral cavity adhere to teeth and gums, etc., to resist being flushed by whatever we eat and drink and end up in the stomach where it's destroyed by hydrochloric acid. Remember, because we're going to mention this a little later, part of the innate immune system is the acidity of the stomach. It's there to kill bacteria. Watch little babies. They crawl on the floor, stick everything you can imagine in their mouth, etc. Do they get sick? No. It's all destroyed by gastric acid. We're going to talk about when you eat and take probiotics, what happens to them in the stomach. Hint, I'll tell you a little more about that later. So let's talk about periodontitis. What is it? You guys know more about that than I do. It's the effect of the inflammation of all the supportive structures around a tooth. Gingival, alveolar bone, periodontal ligaments, and cementum. So let's talk about this a little, and you're going to see where I'm going with this. It's an infection, okay, leading to inflammation of the gingival tissues and this destruction of all that supportive mechanism. The human gingival fibroblasts, HGF, they're the constituent of the structure of the connective tissue, and they release cytokines, inflammatory cytokines, interleukins. So that's important because LPS, lipopolysaccharides, which are the cell wall of gram-negative bacteria, are very strongly pro-inflammatory inducers and are part of this destructive process. And I'm going to bring all this together for you. So the HGF, stimulated by the LPS production, give out these interleukins, IL-1 beta, IL-6, etc., which initiate this process of periodontitis. And, okay, we'll talk about the rest a little later. So, say this name real fast. Okay. Very good. I like doing this to medical students. Anyway, this is found in dental plaque, periodontal pockets, etc., and up to 36% of the normal population, human population, okay? and it can seed and end up elsewhere and cause severe infections wherever it ends. And that includes brain, heart, endocarditis, etc. When you combine it with another friend of this bacteria, Porphyromonas gingivalis, it is associated with coronary artery disease in man. So when you treat this, you're treating where it all starts. Then once it's started, then medicine has to take care of people with heart attacks, stroke, etc. So, oops, go back. This is a sensitive little thing. Okay, so 86% of these strains harbor something known as cytolethal distending toxin, also known as bacterial cytolethal distending toxin, depending on which article you're reading. So it's either CDT or small b, capital CDT. And which this blocks the cell cycle and inhibits the periodontal ligament cells and gingival fibroblasts, so they can't regenerate. They're stuck. You've got this periodontitis and you can't, and it just is a vicious circle no matter what you try to do. And T and B cells undergo cell cycle arrest. These are the two main guys in the immune system, the T cells and your B cells. T cells from the thymus, B cells from bone marrow, basically. And they don't produce your immunoglobulins that protect you from, among other things, infections. So we have the immune system unable to prevent and protect against more bacterial infections, so these guys just kind of take over the whole system and do as they please. In part of the oral microbiome, there are 600 taxa at the species level, so there's a lot of different kinds. And of course, you've also got to consider the nasopharyngeal area, and that's a fabulous area for microbes to grow in. It's warm, it's moist, et cetera, et cetera. And by the way, bacteria from the oral cavity have been found in the brains and blood of patients with Alzheimer's disease. By the way, just as an editor-in-chief, I get to read articles before you ever will read them. You'll get to see them next year. Latest article, 25% of the brains of Alzheimer patients have Borrelia, Lyme, 25%. Anyway, that's an aside. The density and amount of bacteria in the brain of those suffering from Alzheimer's disease is 7 times greater than those without Alzheimer's. So it's significant. So you see all these things preventing, these microbes preventing regeneration, preventing protection, preventing, et cetera, and then what do? They end up in other parts. So another thing is atherothrombosis, major determinant of ischemic cardiovascular events, myocardial infarction, heart attack, and stroke. Antibodies, IgG, immunoglobulin G antibodies to oral anaerobes were present, highly present, in patients with acute coronary atherothrombosis in 88% of patients with cardiovascular disease. It's highly significant, 88%. So earlier when I said that's where it all begins, it really does. So all these bacteria, these gram-negative anaerobes that cause periodontitis, they secrete this brownish black kind of pigment on agar plates. And they have a lot of virulence. One of them is molecular mimicry. Anyone here knows what molecular mimicry is? Good. So let me teach you about that. You take a protein, proteins are made of amino acid sequences, okay? If you present to the immune system a certain sequence of amino acids that make up the protein of, say, a gram-negative bacteria, but you have a tissue in your body that's very similar, so adenosine, et cetera, that are, but a few not, but a few yes. Sometimes the body will mistake that and say, oh, they're both bad guys. I'm going to attack the bacteria and his friend, which is our own tissue. That's how autoimmune diseases start, okay? So these bad guys can start autoimmune diseases. What's a common one in young people? MS. How about rheumatoid arthritis? How about lupus? There's a whole lot. There's about 80 autoimmune disorders. And you know what's happening in the United States? Autoimmune disorders are increasing like this. So, where does it all begin? Let me give you the immunological effects by the microbiome on the brain. It's when we eat what we eat, and we're exposed to environmental chemicals. This room has synthetic carpeting. Synthetic carpeting will release formaldehyde for months and years, for example. Our diet, terrible. A lot of artificial coloring, flavoring, artificial sweeteners. For example, beef is injected with DES before being, about a week before it being sacrificed to transfer the fat into muscle. DES is diethylacetylbestrol, a female hormone. Hogs, that's what they call them, and instead of pigs, they call them all hogs. Hogs getting injected with ractopamine, which is, by the way, banned in every other country in the world. But again, it's injected into the hogs about a week before they're sacrificed because it transfers the fat into muscle, and therefore you get better bacon, better ham, etc. That's just an example. Then we have glyphosate, also known as Roundup, and I could go on and on. So the stress we live in, we live under. And when we have stress, some people turn to, I'll have another glass of wine, please. That kind of a thing. So increased alcohol. Then you have antibiotics. They play a role in this too. And lastly, all of these lead to an increase in LPS and bacterial cytolethal distending toxin in the body, principally where all this is found, which is in the gut, which leads to intestinal permeability. So let me show you something you're going to like. These foods are ultra. These are not processed foods. These are ultra processed foods. Don't raise your hand if you have some of this in your home. Do you get it? Did you see this list? This is what we commonly eat. The United States government did a survey of 800 families who had no exposures, no nothing, etc. They went into their pantries, freezers, and refrigerators, and this was the most common items found in 800 families, average people. So this is what causes all this increase in inflammatory markers. Let me give you a better picture. I live in the Tampa Bay area, lovely part of the country, and this is 100% pure Florida orange juice. And below it, something you have up here in Vermont is cider, but this is apple cider vinegar. On the right is a pH meter. And by the way, these slides were kindly given to me by Dr. Vojdani, who's head of immunosciences laboratories in Los Angeles. What I want you to note is the acidity of the apple cider vinegar, 2.32. Got that? All right. I was upstairs a little bit ago and I saw these floating around in buckets of ice. Look at the acidity of these. Is acid good for teeth? My dentist always told me it's bad. Well, guess what you're drinking? I see two right there on that table. So the point being, it's what we put in our mouths, both fluids and foods, that cause a lot of problems, starting in the mouth. So basically, it's this waterfall effect, and it ends with neurocognitive impairment, Alzheimer's, dementia, Parkinson's, MS, and various other disorders and diseases. Now, antibiotics, a double-edged sword, okay? So we know that poor oral and dental health, as we discussed, and that you know better than anyone, can result in cardiovascular disease and affect cognitive function. Antibiotics are prescribed to get rid of these bacteria that can cause some of these things, okay? So it's a treatment, and sometimes it's prescribed as a preventive medication. And there's a number of oral conditions for which these are prescribed for. Now, lately we're reading a lot everywhere about resistance, bacteria that resist antibiotics. They're resistant to all these very strong antibiotics, okay? Now, granted, for a longest time, about 80 years, antibiotics saved so many lives. People used to die of syphilis, gonorrhea, pneumonia, and bronchitis, and various other diseases that today, they're a no-brainer. They're gone. Instead, we've replaced them with chronic diseases, type 2 diabetes, chronic arthritis, cardiovascular disease, hypertension, et cetera, et cetera. So it's a double-edged sword. They help, but we must remember they do something else. Majority of orofacial infections originate where we talked about, and so the prescribing by the dental profession of antibiotics is, as should be, an important part of how that practice works. So it's one of the major medications prescribed in dentistry. Did you know that 80% of all antibiotics made in the United States are used for farm animals? Just as an aside. Dentists prescribe between 7 and 11% of all common antibiotics. Okay? And it's also associated with unfavorable side effects. You get some diarrhea, you might get some, the worst part is an anaphylactic shock, but that's rare nowadays. But also the development of resistance to the antibiotic. So what should you do? You should really only use them where there's drainage and debridement is impossible. So you need to kill that bacteria different way. And post-operative local complications, etc. So those are good, but a lot of people, believe me, and of all the healthcare professionals, pediatricians are the worst. Baby comes in, fever, earache. Mom says, I want an antibiotic. Sure. Boom. And now, but so just be aware of these things. Now, CDC says that 2 million people become infected with bacteria that are resistant to antibiotics and causes 23,000 persons to die. Well, from 1996 to 2013, medical doctors prescribing antibiotics declined by 18%. At the same time, dental prescribing increased by 2/3. And mostly in patients over 60. I'm just bringing evidence to you. I'm not telling you what to do or not to do. The only person who can tell you what to do with a patient is you, because that patient is right there in front of you. So I'm just bringing these things to your attention. What can you do about this? Okay. What can be done to help? And by the way, quinolones, which are famous, what's the major problem with quinolones? They don't tell you. Well, they tell you, but it's tendonitis, ruptured Achilles tendon, and it's pretty common. It's not 1 in 100 million or something like the pharmaceutical industry would like us to think. So what can you do? Let's look at yogurt. I wrote an article, published an article on yogurt a few years ago, so I really researched it. It's a $30 billion a year industry, good to invest in. But here's the funny thing about it. All in this country, every dairy product has to be pasteurized, okay? Which means it has to be heated to the point where it kills all bacteria, good and bad, and that's it, okay? Yogurt is also pasteurized after it's been fermented. What does that do? Kills all the bacteria, right? Yes? Are you all listening to me? Okay. So then, just before it leaves the factory, just before the top is put on, they sprinkle some bacteria on it and quickly close it up. No one knows how long those bacteria live. There's been not a single study done on their viability. Now, you look at the little things and say, you know, it's got this and this and this. But you don't know if they're alive or dead. But remember we talked about the innate immune system and gastric acid? Guess what happens to the two principal bacteria in probiotics, especially yogurt and all the other common ones, which is lactobacilli and bifidobacterium. When they reach the stomach, boom, they're killed. But, so, by the way, in looking up yogurts, some of them have, you know, yogurt used to be yogurt. Now it's vanilla, chocolate, strawberry, blueberry, anything you want. Some of these have actually got high fructose corn syrup, artificial flavoring, artificial coloring, and all kinds of stuff in it, which in and of itself is going to cause a problem to the microbiome. Okay. So, at the Reading University in the UK, the food safety, the FSA, which is the FDA of the United Kingdom, sponsored a study, and they found that less than 10% of the usual commercial strains of lactobacilli and bifidobacterium actually pass through the stomach and go on and reach the colon. So when you spend money to buy something that you think is going to get there, would you spend that same amount if you knew that there's a good likelihood that it may not, and if it does, it's a very small percentage? So think about that. Now, probiotics on the market, and I go to all these conferences all over the world. It was mentioned, I lectured at Oxford in England, at MIT, at Harvard, and in the exhibit rooms, sometimes there are up to 5 different companies selling probiotics. It's amazing. And so I do certain things that bother them. I go up to them and I say, do you have any human clinical trials available to read on your product? No, but we've got all this other stuff. It's amazing. They nothing, okay? So, they don't make it. Some make it a few percent, as you can see. There's a few that make it 100%, but I'm not going to name names. There's maybe 3 companies. UC Davis, University of California, Davis, the other side of the United States, did a study 2 years ago. They went to stores in the area and they bought 16 bottles of different probiotics and took them back to the lab and wanted to see if the strains on the bottle matched what was in the capsule. Out of the 16, only one did. Here's something else. All 16 were for children. Talk about quality control. So what are you buying? Dead bacteria therapy. Now, these probiotics, mine's bigger than yours. My product has 200 billion colony forming. Yours only has 100. So, there isn't a single study that's been published that shows that this many is better than that many, etc. Or that 5 strains is not as good as 20 strains. No, nothing. There's nothing, no proof, nothing published. So most probiotic studies, and they're done. A lot of them are done in animals, mice, chickens. They're very nice, but they usually have one single strain and very limited amount. Well, you got to match it to the chicken and to the mouse. But there's no reasoning behind this kitchen sink thing of putting on all these strains at these huge quantities in a capsule. That's not going to make it through the stomach. So the one you want is the one that has undergone DNA sequencing. Okay, what's a true antibiotic? So these probiotics are really, as I said, dead bacteria therapy. Sometimes, and there are some studies which have shown they do have a transient effect, for example, diarrhea in children, etc. But do they actually provide a long-lasting anything? No, they don't. So they do not go live in the gut and cause a shift between good and bad bacteria. They don't do anything at all in the mouth whatsoever. So what is a true probiotic? Get bacillus species. Anything that says bacillus. Why? Because they're spore forming. And if you remember your microbiology, who here took microbiology? I think we all kind of did. Why? Because they form spore. Lactobacilli and bifidobacterium don't form spores. Spores, if you remember, I had a really good microbiology teacher. Spores started when Earth was first formed. They're really old. They can be cooked, fried, you name it, and they resist. They resist ice cold and they resist extreme heat. So they make it. They make it all the way through. Why? What's the next acid after stomach acid? Bile acid. Okay? So all these steps, no, these guys make it on through, which is great. And they disseminate. They're immunogenic. They help the immune system. And that's been demonstrated in study after study. There are some strains, like the Indicus HU36, that produce antioxidants. Who doesn't want to take an antioxidant? I mean, carotenoids, lycopene, lutein, beta-carotene, etc. They produce these inside once they get there. So they've got a lot of benefits. Immune modulation in childhood allergies. I told you about T and B cell lymphocytes. One of the things is, in my practice, there's always some women who have chronic cystitis or chronic UTIs, urinary tract infections. This gets rid of that. And also, it helps for those I've had to do it once. I had to take H. pylori therapy. If you take a bacillus-forming bacteria as a routine, you won't be as affected by that terrible triple therapy. I didn't like it one bit. It helps SIBO, small intestinal bacterial overgrowth, and diminishes diarrhea in children, reduces IBS symptoms, but the diarrhea type, not the constipating type. And there was a study done in on rheumatoid arthritis patients. They took 90 rheumatoid arthritis patients, and for 120 days, they gave them bacilli spores, bacilli, that spore-forming bacilli. Now, all these patients were on DMARDs, disease-modifying medications like steroids, et cetera, and most of them didn't do much all day because movement causes pain in any patient with rheumatoid arthritis. They have trouble buttoning buttons, they have trouble opening up a door, they have opening a bottle, a jar, anything like that is painful for them. So they tend to sit a lot, especially in, say, in a recliner. They do very little. They'll go to the mailbox, they'll go to the bathroom, they'll go to the kitchen, they'll go to the bedroom. They're very limited. At the 120 days, they started walking. They could walk. And you know what happened? They walked several miles a day. So I called the lead author of the article. I said, I don't walk several miles a day. Why would these people walk? Why were they walking several miles a day? Were you telling them to walk that, or what was the reason? He says, no. For so many years, they'd been stuck at home. They were so happy that they could go out and see things and do things and be pain-free and not have all kinds of aches, etc., that they liked to walk to see things. That's why they did it. Imagine that. I hadn't thought of that, but it's really amazing how pain really can suck the life out of you. So make sure it's got DNA verification. Make sure it's got human clinical trials, okay? And once you do that, then you're okay. So I brought you through a kind of what happens when you're born, lactobacilli. All these things have to do with bacteria. And what I'm trying to show you here also is that there's these bad guys, there's the good guys, there's good, the bad, and the ugly in these bacteria. These help us, but there's others that don't, and others that do help, like the bacilli for babies.